Hello and welcome in everybody to our webinar themed 10 Myths of Medicare presented by Market Medicare Advisors. My name is Trey Basa, a health insurance advisor with Market Medicare Advisors. Before we kick things off, there's going to be a lot of information and this is pre-recorded, so I cannot answer questions at this time. But if you do have any questions or you want a more elaborate explanation for you and your personal circumstances, please check out that website down below and we will be in touch to make sure that we are helping you to the best of our abilities. But first and foremost, a quick disclosure. We are an independent brokerage. That means we're not affiliated with the federal government, the Medicare program, the Social Security Administration. We're going to talk a lot about all of these different agencies, but we don't represent any one of them. We just have experience working with them. So without further ado, we're going to get into myth number 1. You are automatically enrolled into Medicare. Now, this isn't always the case, but for a lot of Americans, it is. It is only true if you are drawing Social Security or receiving a retirement board check before you turn 65. In this particular case, you're going to be automatically enrolled into Medicare about 3 months before your 65th birthday. They'll issue you a Medicare number, they'll send out this red, white, and blue card, and with all of that information, you can enroll into all of those other parts of Medicare. But this indicates the beginning of everything. And sometimes you're not automatically enrolled. But if you do choose to enroll into Medicare Parts A and B before your 65th birthday, you have to manually enroll. What that means is you have to correspond with the Social Security Administration. You have to fill out some paperwork, making sure that all of your T's are crossed, I's are dotted, and then you have to play the waiting game. You have to wait for this red, white, and blue card to come into the mail so we can use this Medicare number and these effective dates for the rest of your enrollment process. So this myth isn't entirely true. Sometimes you are automatically enrolled, sometimes you aren't. But it really comes down to the individual and what they are aiming to do, the timelines that they are aiming to meet. On to myth number 2. Getting Medicare started is a long and strenuous process. And I'm here to tell you, it's not that hard. I've enrolled personally hundreds of people into Medicare Parts A and B, and by far, the easiest way to enroll into Medicare is online. SSA.gov. You fill out your information, you make an account, and then you can access so much more just from SSA.gov. You can check on your Social Security, what age you would get what benefit, but most importantly, you can apply online for your Medicare benefits. It's just a quick 10-minute application verifying your information, your identity, as well as your work insurance. Perhaps you worked past 65, you need to provide a little bit more information to prove that you've had creditable coverage, which we will get into in just a few slides. Or perhaps you have an afternoon to kill. You want to go to the Social Security Administration and wait in line, or wait on the phone in some sort of queue to talk with a representative, and they will help you through the same application. But like I said, I've done this many times before. This is something we actively do with our clients all year round. If you're interested in getting this kind of help, just getting Parts A and B started, please visit that link down below the video so we can be in touch and get you guys started in the appropriate time frame. On to myth number 3. Myth number 3, you must start Medicare on your 65th birthday. This is perhaps the number 1 thing we are debunking in our offices today, because a lot of people come to us with hurried expectations. I'm turning 65 in a couple of months. I need to start Medicare. But that's not where the conversation starts and ends. There's a lot more to it that we need to understand to make sure that you are making the right moves. So the myth is you must start Medicare on your 65th birthday, and that's not entirely true. A lot of people are obsessed with the first enrollment period people have to get into Medicare, no problem, and that's called your initial enrollment period. This is a 7-month window around your 65th birthday. 3 months before, the month of, and 3 months after. This is your first opportunity to enroll into Medicare, and it is not an opportunity you have to take. Again, it comes down to your personal circumstances and plans. But fear not, there is a second opportunity to enroll into Medicare called your special enrollment period. This is going to be a special code we use to get into Medicare Parts B without any problems, fines, fees, penalties, no hassles whatsoever. This special enrollment period is for anybody who is continuing to work past 65. Whenever somebody approaches us trying to get onto Medicare Parts A and B, we have a couple of extra steps to take, some extra papers to fill out in order to prove that past the age 65, we had creditable coverage and we can now enroll into Medicare Part B, no problem. Those papers are CMS 40B and CMS L564. These are the forms that we're going to be filling out with you in order to prove that you've had creditable coverage past the age 65. The form on the left is going to be everything about you, personal information, perhaps you already have a Medicare number, a Part A, and finally remarks in box 12. I would like Parts A and B to start on X date. The form on the right is going to be filled out in part by you and in part by some sort of HR representative at your work. This is going to be them, the HR representative, vouching for you that you've had creditable coverage past the age 65, that you've been covered under workplace insurance. Again, if you have any hesitations, you need help filling these papers out or even just getting a digital copy of these, please reach out to us at the link below. We are here all year round to help folks just like you. On to myth number 4. Myth number 4, you can start Medicare anytime. This is a review. The 2 periods that we just talked about are first, your initial enrollment period, and that's that time frame around your 65th birthday, but you do not have to take it. It is there if you so choose, but it is not required. And if you don't choose that time period, you also have the special enrollment period for any time after the age 65 to enroll into Medicare, no problem. All we have to do is fill out those 2 forms I just showed you, the 40B and the L564, in order to prove that you've had creditable coverage past the age 65. Now we're going to get into the more nitty-gritty details of Medicare, Parts A and B. So myth number 5 states Medicare insurance covers all medical expenses. And that's not entirely true. As we deep dive into Parts A and B from the federal government, there's a lot to digest. And as we explain all of these different benefits, you'll understand that Parts A and B that come from the federal government are rather lackluster in coverage. So let's get into it. Parts A and B. Part A is your hospital insurance. It has a premium of $0 a month. But when you turn around and use it, Part A gives you access to any hospital, any skilled nursing facility, inpatient hospice care that accepts Medicare. If they don't accept Medicare, you'll know. They will make you sign some paperwork saying that you accept that you are responsible for any costs that might occur during that visit. What do we get from Part A? Number 1, every time you're admitted into the hospital, you have a deductible to pay. Next year, 2025, that deductible is $1,676 every time you're admitted into the hospital. That buys you the first 60 days. After day 60, you're going to be paying per day, and that is going to be at $419 per day in the hospital for a grand total of a 90-day stay. If your stay is longer than 90 days, then you'll be paying $838 a day for a limit of 60 days. Now, once those 60 days are used up and your stay exceeds 90 days again, you will be paying 100% of that hospital stay every day you're in the hospital. Finally, from Part A, we have coverage for a skilled nursing facility. This is going to be a separate wing, a separate building that people go to get back on their feet, perhaps after major surgery, an accident, some major fall, and they need to get back onto their feet, a little bit of rehabilitation. The skilled nursing facility has days 1 through 20 covered under Part A. That's going to be a $0 a day copayment. But if you're in there 21 to 100 days, you're paying $209.50 a day. And that can add up fast. Anything longer than 100 days for that one stay, you are going to be responsible for that the entirety of that stay past 100 days. So with that, that's a quick summary of everything for Part A. $0 a month, not too shabby, right? That's only half of the equation. Part B is for everything outpatient. This is going to be your medical insurance. Next year, Part B has a base premium of $185 a month. Again, with Part B, you have no network restrictions. If a doctor facility accepts Medicare, they will accept Part B. Now, when you use your Part B for anything outpatient, like surgery, regular doctor's visits, more advanced tests, procedures outside of the hospital stay, this is where Part B kicks in. And after a dirt low $257 annual deductible, you have to split the bill with the government, 80-20. Luckily, Medicare beneficiaries only have to cover 20% of any bill that comes their way. Unfortunately, that 20% is unlimited. You'll be paying 20% for the rest of the year. When we're looking at any one charge under just Parts A and B, a doctor, physician, any facility can charge up to 15% more than the standard rate of that procedure, that meeting. What we mean by this is excess charges. They can, upcharge you from the initial $10,000 procedure. For this example, $10,000 is going to be split between you and the federal government. $8,000 is going to be covered by the federal government. You will be responsible for $2,000. But if that facility does upcharge you that maximum 15%, now you're looking at a $11,500 procedure. Medicare is only going to pay for what they originally thought was their 80%. And you, the Medicare beneficiary, are going to be responsible for your original 20% plus an extra $1,500, or that 15% upcharge, for a grand total of the $11,500. Now, this is not the case all the time. 15% is very, very high, but generally we see closer to 4 to 7%, a little bit of fluctuation. And it's those little percentages that catch people. And remember, you're paying 20% plus these excess charges for everything after a $257 annual deductible. Before we get into answering why we pick up Parts A and B and a supplement plan or an advantage plan, we're going to talk about the cost of Medicare. Like I said, with Medicare Part B, the base premium is going to be $185 a month for all of 2025. But that's just the base amount. When we're taking a look at Part B, your premium is determined by your tax return 2 years ago. So taking a look at this chart, $185 is the base premium, but depending on how much you filed and how you filed your taxes, could rate up your premium for an entire calendar year. So take, for example, single Part B premiums were $185 a month. But if that individual's tax return exceeds $106,000 to $133,000, they could be upcharged to $259 a month. Again, this is determined for the calendar year, and it's based off of your taxes 2 years ago. So all of your Medicare premiums, Part B and D, are going to be based on your tax return from 2023. And this is going to be an ongoing process. It'll always be a 2-year look back period. Whenever we sit down with clients, we sit down with them every fall to review all of their policies, make sure they're a right fit for them next year, as well as any correspondence they might have gotten. And this IRMA charge, the income related monthly adjustment amount, hits a lot of Americans every year. It's because in retirement, at some point, their income is out of their control. And all of a sudden, they have to pay tens of hundreds of dollars more a month just because they don't have control in their retirement. So please reach out, use that link below the video if you need help assessing any IRMAA charges and any ways to get yourself rated down, perhaps not paying the full $259, $370 upcharge from IRMAA. There is paperwork to fill out. There are things to do with this that we can help you understand and possibly navigate. But at the end of the day, it is going to be a review, an appeal process by the federal government to see whether or not they're going to rate you up or down. With that, we're going to get into our 7th myth for today. When we're taking a look at parts A and B, they're rather lackluster in coverage. So myth number 7 comes into play. All Medicare supplement plans are equal. This is the first solution people pair with Medicare parts A and B, but they are not all the same in coverage. When we're talking about parts A and B, there's a lot of financial responsibility, but when we're looking at pairing a supplement plan with parts A and B, they are regulated by the federal government. So all of these Medicare supplement plans, a couple of key points to note about each of them. They are the same in essence, but they don't all have the same coverage. For instance, when you first sign up for Medicare or Medicare Part B in general, you have the opportunity to enroll into a Medicare supplement plan, no problem, no underwriting. There is no fine, fees, penalties for enrolling into this whenever you first sign up. But that's the problem. You need to be aware of your time frame. You need to be aware of when you enroll and how it plays with a lot of your other retirement plans. A couple of things to keep in mind, that these are renewable for life. They'll never drop you no matter how much you use it. They'll renew you every year. You will have your premium stair step up every year, but it's guaranteed for life. They'll never drop you no matter how much you use it. Finally, rates do increase, but we see the largest increases in premiums about every 5 years. So, what does a Medicare supplement plan look like? There's a lot of different flavors. To confuse you even more, they're all labeled with letters A through N, but they don't all have the same coverage. Now, these A and B supplement plans are not the same as Medicare Parts A and B. This is going to be strictly from a private insurance carrier. Whenever we're looking at supplement plans, it is to pair with Medicare Parts A and B. What do these plans look like? Number one, we have a couple of popular plans, plans F, G, and N. They are the most prevalent on the market, but they all have different strengths and weaknesses. So when we're taking a look at plan F, a lot of people are enrolled in plan F because if you follow this column all the way down, there is 100% coverage every step of the way. Now, what does this coverage look like? We need to look at the benefits column. Remember when we were talking about Medicare Part A, the hospital insurance? Every time you went to the hospital, you have a $1,600 deductible to fulfill. If you take a look at our chart, Medicare plans F, G, and N cover that Part A deductible 100%. So every time you go to the hospital, that deductible is covered by your private insurance carrier, your supplement plan. Another benefit, your Medicare Part B coinsurance. If you recall, Part B has a deductible that you are responsible for on most plans. You have to pay this Part B deductible on most of the supplement plans on the market. But after that dirt low deductible of $257, you're responsible for 20% of any outpatient bill that comes your way. So doctor's visits, tests, scans, surgeries, procedures, whatever, you are responsible for 20%, unless you have a Medicare supplement plan. This supplement plan is going to cover your 20%. Whenever you are on parts A, B, and a supplement plan, you have virtually no hospital or medical bills coming your way. You have no network restrictions because this is all accepted wherever Medicare is accepted. And you would be hard-pressed to find somebody somewhere that doesn't accept Medicare. And if they just so happen to not accept Medicare, you will know. They will make you sign paperwork saying you assume responsibility for any cost bills that occur for any services that they render. They will make you sign that. You will know if they don't accept Medicare. But for a majority of providers, all of this is going to work at your current doctor, hospital facility, because Medicare supplement plans are the one way that you can get 100% coverage in retirement. We're going to take a look at more of these benefits and how they play into a lot of retirees' everyday health procedures, checkups, and whatnot. That Part B, coinsurance copayment, covered 100% by a lot of different supplement plans. But the number one plan people are getting into today is the Supplement Plan G. And that is because right now, if you turn 65 after December of 2020, you are a guaranteed issue into a Plan G. What that means is that there is no medical underwriting, no health history consideration whatsoever. You can get into a Supplement Plan G, no problem. With all of these different supplement plans, you get virtually 100% coverage. What's the catch? It's more of an exchange. You're guaranteed coverage. No hospital medical bills, no network restrictions, in exchange for a reoccurring monthly premium. Whenever somebody signs up for a supplement plan, it is guaranteed for life. All they have to do is just stay on top of that monthly premium for virtually 100% coverage and no network restrictions. The final plan to highlight is the Plan N, and the Plan N is the cheapest out of the three. Plan F, high, Plan G, medium, Plan N, low. But Plan N has a lot more financial responsibility placed back onto the Medicare beneficiary. Plan Ns generally have copayments. They're still 100% usable in the Medicare network. If they accept Medicare, they accept your Plan N. But at the end of the day, it is another exchange. You're opting into less coverage for your supplement plan. See, down here, you're responsible for your Part B deductible and excess charges, but you are agreeing to a lower premium as well. That's the exchange there. So just a quick recap, we talked about three supplement plans: the Plan F, the Plan G, and the Plan N. These are the three most popular plans on the market today, but you are a guaranteed issue into a Plan G. You can get into it, no problem, and it will be good for the rest of your days. This is how people get to that point where they can rest and they can relax in retirement because they have this option for Medicare. But it's not the only option. The other option folks have is also called a Medicare Advantage plan. Now, Advantage plans, as the myth goes, are more expensive. And that's not the case. The case in a majority of the stories that I hear, the case is that people are mismanaging their Medicare Advantage plans. 90% of these cases, these stories that we hear, come from folks that do all of this on their own and are trying to digest all of this complex information by themselves. That's how a lot of these cases are mismanaged and end up costing Medicare beneficiaries more than the promised outcome of a Medicare Advantage plan. Before we get into some details on what an Advantage plan could look like for you, let's talk about the concept of an Advantage plan. So first and foremost, you do have to maintain parts A and B. You have to pay that $0 a month for Part A and that $185 for Part B. Now, when you sign up for an Advantage plan, you agree to operate within a network. And there are two kinds of networks. There are HMOs and PPOs. A lot of these Advantage plans are structured around these two kinds of networks. HMOs, or health maintenance organizations, are very tight-knit communities. They don't offer any assistance outside of that network, but they offer really good rates inside the network. The other network, PPOs, Preferred Provider Organizations, again, they work really well in network. They promise really good rates in network. But what differs the PPO from the HMO is that outside of the network, they offer a percentage of assistance for their Medicare beneficiaries. So generally, we do look at PPOs more often, but it is up to the individuals whether they want PPOs or HMOs. Now, most Medicare Advantage plans have little to no monthly premiums. So depending on the company that you use and the plan that they issue, you could have almost $0 monthly premiums just to be a part of this plan. But that's going to get into our next myth. Not everything's going to be $0 because you agree to the network and you agree to the co-payments the insurance company will give you your plan for little to no monthly cost. Comparing those two, you can save money, and that's what gets a lot of people that $0 a month. But you have to manage your Advantage plan correctly, operate within these networks, use the benefits of the Advantage plan to make sure you are taking the best care for yourself. And finally, the insured is responsible for co-payments. So although you are paying nothing every month to be a part of the plan, you're agreeing to pay for services that do get rendered while you are on the plan. Every year, Medicare beneficiaries have the opportunity to switch from one Advantage plan to another during this period that we call the annual enrollment period. This is where folks can take a look at everything else on the market, what is coming to 2025, and what is going to be changing with their current plan. And between these dates, October 15th through December 7th, every year, beneficiaries have the ability to review and change their Medicare Advantage plans. That's why we encourage all of our clients to come back every year. In the fall, we sit down with everybody to talk about where they're at and where they're going, as well as where they could be on a different plan. This time period is essential to make sure that you are managing your Medicare Advantage plan correctly, making sure you're not getting blindsided with all of these different co-payments, these different benefits, or network changes. Whenever we're considering a Medicare Advantage plan, a lot of people like to throw around the word free, which comes to myth number 9. Medicare Advantage plans are free, and this is not the case. Again, when you sign up for a Medicare Advantage plan, you agree to a $0 a month premium, but you're also agreeing to a network. You have to operate within that network. So let's take a look at what Medicare Advantage plan co-payments could look like. So the plan itself costs $0 a month, but in order to see your primary care physician, your primary doctor, that could cost you anywhere from $0 to $20. When we're talking about a specialist, a cardiologist, a neurologist, ears, nose, throat doctor, that specialist could cost $25 to $50 every time you visit them. I will say this, Medicare Advantage plans are really big on preventative services. They want you to take care of you. So they give you a lot of preventative services at no cost. So we're talking a lot of screenings, a lot of preemptive checkups, a lot of benefits for anybody on Medicare Advantage plans to check up and take care of themselves. Lots of screenings. Urgent care emergency rooms do have a copayment, $50 to $150. Depends on the plan, but there are no network restrictions. If you have an emergency, you just go. A couple of other things that you could possibly run into on the Advantage plan: tests, labs, x-rays, anywhere from $0 to $50. MRI, CAT scans, the big diagnostic imaging stuff, $200 to $400. Outpatient surgeries, depends on the surgical center, depends on the surgery itself, how advanced or simple it might be, anywhere from $250 to $400. And finally, hospital stays. Every day you're in the hospital, you have a copayment. Now, what these copayments illustrate is that the Advantage plan is taking over your healthcare. Remember Parts A and B? We talked a lot about the financial responsibility folks have on Parts A and B, but you're no longer paying that 20% for Part B. You're no longer paying that deductible for Part A. You pick up an Advantage plan to operate in a network for $0 a month, and you only pay for services you get rendered. That's where this chart comes into play. This is not a true example of any one plan on the market, but this is a generic example of what you could see from any Advantage plan. You agree to these co-payments while you are on the plan for the calendar year. Now, this is just the big stuff, the medical, the hospital stuff. But like I said, Medicare Advantage plan is really big on preventative services. They want you to take care of you. So they do include a lot of extras at no cost. Medicare Advantage plans include all of these benefits for Medicare beneficiaries to take care of themselves. An example, Medicare prescription drug plans built into the plan itself. It's not an additional plan you have to pick up. We are going to dive into Medicare prescription drug plans in a couple of slides, but just know that it is built into the Advantage plan. A lot of them include gym memberships. That is a staple in today's Medicare Advantage plan. It is network restrictive. Got to make sure your gym is in network for whatever program that the Advantage plan uses. But you can save 20, 30 bucks a month by picking up an Advantage plan and using their gym membership. Over-the-counter allowance may include OTC allowance. That's what OTC stands for, over-the-counter. We're talking about the generic allergy, cough syrup, toothbrushes, toothpaste. Medicare Advantage plans give you $25, $50, sometimes even more, $25, $50 a month just to use in their online pharmacy and get some over-the-counter stuff delivered straight to your door. Another staple in Medicare Advantage plans are dental, vision, and hearing benefit. They want you to take care of your eyes, teeth, ears, because a lot of health problems do stem from your eyes, teeth, ears when you get up there in age. A lot of retirees are looking for dental, vision, and hearing. Medicare Advantage plans just so happen to include that. Keep in mind, this is network specific. So they will give you X amount of dollars to help with any dental, vision, hearing procedure, checkup that you might have. In fact, they'll give you a lot of preventative checkups, teeth cleanings, ear exams or eye exams at no cost if it is done in network. A drawback to Medicare Advantage plans are going to be pre-certification. This is what we call prior authorization, pre-approval. You will become best friends with your primary care physician, because on an Advantage plan, you do need referrals. You can't go see anybody anywhere, anytime. You have to have a reason to go see them, and that is often going to come from your primary care physician. Now, you can switch from this Advantage plan to that supplement plan that we talked about earlier, but you may have to medically qualify. You'll have to answer these health history questions, give them a list of your prescriptions, why you're taking them, how long you've been on them, and then it's up to the private insurance company whether or not they're going to give you a Medicare supplement plan. Again, these Advantage plans you can review and change every year, October 15th through December 7th. The final note on Advantage plans is you cannot have Advantage plan and supplement plan. It is one or the other. When we're taking a look at an individual, their needs, and what they could get out of any one route, it does come down to the individual. We talk to them about their health history. We figure out what makes them who they are today. But these Advantage plans is not a one-size-fits-all for everybody. That's why we do both Medicare supplement plans and Advantage plans. It's important for you to have the option because, again, supplement plans and Advantage plans are not a one-size-fits-all. We're going to get into the last topic of the seminar. The myth number 10 is you don't need a prescription drug plan if you're not taking any medications. This is probably the number 2 or number 3 thing that we hear in our offices. I'm not on any prescription drugs. I don't need a prescription drug plan. I'm here to tell you that although you might not be on anything, I will encourage you to pick something up. Here's why. For every full month you go without prescription drug coverage while on Medicare, you incur a penalty. That penalty is 1% the national average premiums for prescription drug plans. Now, last year, 1% of this national average was 40 cents. So if you went all of last year without a prescription drug plan while on Medicare, you incurred a $4.80 penalty. That means you have to pay an additional $4.80 plus whatever else premium-wise you have when you finally do get on a prescription drug plan. If you don't, that penalty keeps accruing, it keeps growing, and that is going to be a lifetime penalty. You have to pay that every month if you want that coverage in the future. Nowadays, everything prescription drug-wise, these different plans, they have a lot of different premiums and a lot of different coverage. If you're not on anything, just get a plan for as cheap as possible. It'll save you some pain down the road. I can't talk about any particular plan or company because this is an educational seminar, but if you're interested in getting a quote, learning more about your options, please visit that link down below and get in touch with us so we can have a greater conversation about you and your personal circumstances. So again, without a prescription drug plan, you do incur this penalty. That's why we encourage people to just pick something up. What that prescription drug plan could look like depends. There are a lot of different companies and a lot of different plans. So when we're looking at it, we do have to consider an individual and their list of prescriptions. So every plan is formulated differently. They have preferred and standard pharmacies. Some plans work better in some places than others. We also have a formulary. It's a big old book where they put prescription drugs in and they give them different tiers. Tier 1 is going to be the cheapest. Tier 5 is going to be the most expensive. But their coverage for each of those tiers varies between all of the different plans. And finally, you can switch your prescription drug plan every year. Same time period, October 15th through December 7th. You can sit down, review your list of scripts, and see what is going to be the best fit for you the coming year. Now, every prescription drug plan is created differently. They cover different prescriptions at different rates, but they all have the same stages in which you pay. So we're going to go over those 3 stages and kind of what you can pay at different tiers. So the first stage of pay is going to be your deductible. You have to pay into these tiers 1 and 2 before you get coverage for tiers 3, 4, and 5, the more expensive stuff. Tiers 1 and 2, you have a flat co-payment from day 1. You know what you're going to pay for tiers 1 and 2, and with the help of an advisor, you know what you're going to pay for tiers 3, 4, and 5 before you get coverage when you're in that deductible period. The second stage is called initial coverage. This is where we get the most coverage on our prescription drug plans. This is where we want to spend most of our time in because starting from January 1, 2025, we have a maximum out-of-pocket of $2,000 to spend in your initial coverage. After that, you get coverage for everything at $0 copayment in stage 3, catastrophic coverage. Again, in stage 2, you spend $2,000 on all of your prescriptions. After that, you moved into stage 3 for a $0 copayment when you pick up scripts. You just have to keep on top of the monthly premium to be a part of the plan. Now, like I said, all of these plans, they're structured the same. So this tier list down below, tiers 1 through 5, they're all going to be very similar from plan to plan, but you can generally expect tier 5s to be more expensive than tiers 1. When we're taking a look at an individual's list of prescriptions, we sit down with clients to talk about every script, every dosage, how frequently taken and filled everything on their list is. So up here on the TV, we have a couple of examples from a real life client. We sit down and we talk about this is what you're on, this is what everything costs. This is what you can expect to pay in January for a quarterly fill. And then when you get everything again, you hit this stage of coverage. And this is what you can expect to pay in April. This is what we do with clients every time we meet to talk about these plans, before they sign up for Medicare or during that annual enrollment period while they are on Medicare. If this is something you're interested in, just a review of what your current policies are, please check out that link below. Get in touch with us so we can have a greater conversation about you, your personal circumstances, and your policies. Because not all of these plans are one size fits all. So that's going to be it for the Medicare Boot Camp. I'm going to talk briefly about why you should work with Market Medicare Advisors. I have 5 reasons that we've found from our current clients that keep them coming back every year. And first and foremost is we have experts that help all year round. We're a full service agency. It is not a sign you up and kick you out the door kind of relationship. We are in office to field phone calls, emails, to hold these meetings all year round, because it's important for you to understand that you are not alone in this. You don't have to navigate this Medicare minefield all by yourself. We are here, and we are here for you. Number 2, you could shop around all you want. All of these Medicare and prescription drug plans, they're all the same. And we charge no fees. There are plans that are out there that you're going to get, they're going to be the exact same price, whether you have our help or not. Relationships matter to us. I'm here giving this webinar because it's important to have this information. If you're on Medicare, you might get the Medicare and Yearbook every year. And it's up to you to read through that book, to figure out what's going to be the best fit for you. Or you come in, you talk with an advisor, and you get solid recommendations so you can move forward in your retirement without having to worry about your healthcare policies. Number 4, we have 150 years of experience in 4 different sectors, including Medicare. Like we've talked about with Medicare Part B, your Part B premiums are determined by your tax return 2 years ago, and it will always be a 2-year look-back period. That's why we also have advisors to talk about financial planning, tax planning, and estate planning, all under one roof, just for you. And finally, we advocate and stand by you. We don't represent any one insurance company. We work with a number of insurance companies for both supplement plans and advantage plans, so you have the options at your disposal and pick what is best for you. Ultimately, we will help and advise you on what we think will be the best fit, but the decision does come down to you, the individual, and what works for you in your certain life circumstances. That is why you should work with Market Medicare Advisors. A couple of things about our firm is that we have multiple shows with all of these different advisors coming together to talk about all of these different things. Financial, tax, estate, and Medicare planning, all on one show. And the big one is Retire Hour, hosted by Matt Goolsby. This is our weekly radio show talking to all of the advisors about things that we're doing with clients today. On our website, you can check out previous episodes as well as read some biographies, meet the teams, and get to know the team before you come in to talk to us. We also have a television show called Eye on Retirement. Eye on Retirement is a 30-minute television program where we get a panel of all of our advisors to decipher what we are doing with particular clients, what we're seeing in the market, and how we are helping folks today. Real life cases for real life people. With that being said, my name is Trey Basa with Market Medicare Advisors. If you're interested in having a greater conversation about your Medicare options, perhaps getting a review if you're already on Medicare, please feel free to give us a call at 833-MAG-REPORT. That's 833-MAG-REPORT, or you could email me at trey@marketmedicareadvisors.com or visit our website, marketmedicareadvisors.com. With that, I thank you for coming out to today's webinar, and I hope to hear from you soon. Take care.